much bed rest is too much when you have back pain? I asked spine surgeon Dr. Georgiy Brusovanik about different treatments, and here's what he said.
As an orthopedic surgeon, I follow the guidelines of the American Academy of Orthopedic Surgery, and there are some reasonable evidence-based guidelines. For example, physical therapy for patients who have abdominal sort of laxity, patients who have tight hamstrings, patients who have sort of unusual body mechanics from having a lifestyle that doesn't allow them to move around, you know, someone who sits for a long period of time. I think therapy can be a real lifesaver. And there are some outstanding therapists here in our community that make a big difference for patients.
Rest and time, two things that most people don't have time for, rest or time. But they actually do help.
They do, and since the majority of back pain gets better, a couple of days of sort of less activity and 2-3 days of time, that will probably help in most cases.
So bed rest is still sort of the go-to a little bit, or no?
Not bed rest specifically.
Okay.
So no more than 24 hours of bed rest.
Okay.
And there is some evidence that shows that anything over than a day of bed rest is associated with losing bone mass. So especially in the elderly, I would make an extra effort to sort of get to the bottom of why you're suffering instead of just laying around in bed.
Thank you for clarifying that. We have a caller. We have a Sharon from Palm City. Hi, Sharon. Good morning. Are you with us?
Yes, good morning.
Good morning.
Hi, doctor. I have a protrusion at T12. They tell me it's rare, but it's very painful, and I've had this now for 2 months. I have been unable to work, and I'm in a lot of pain. And I've tried chiropractic and physical therapy and all different modalities. Nothing seems to help it. And now they're telling me maybe I should have surgery, that they have to chip away at the pad between the vertebrae because it's sticking into the nerve and causing the pain, pinching the nerves. And I was just wondering what would be your opinion?
Did you say T as in Tom, thoracic 1-2?
Yes.
So Sharon, do you have pain deep to your shoulder blade?
Yes, around the shoulder blade, around the breast area, all the way down into my elbow is very, very tender. And it's causing some breathing problems and shooting up into my neck all the way down into my waist area.
Sharon, I would advise you to obtain an MRI of your neck. The most common cause...
Yes, Doctor, I've had MRIs done.
And what did the neck MRI show?
It showed some slight degeneration. I can't even say it. Degeneration of the in that area, but it's the protrusion in the L1-2 area that's causing the nerve damage.
I see. Sharon, I would not rush into surgery. Absolutely not. I would try injections. I would verify that by placing an anesthetic in the area that you think is the source of your pain, you should use that as a tool to see whether that's really the source of your pain. So you do an injection at that level. If the pain goes away, then you know that that's really the culprit. But from your story, I would be surprised if an operation at T1, T2 would make any difference. Pain deep to the shoulder blade usually comes from the neck. And you did mention pain going towards your elbow. That definitely supports my theory, because if you have a disc problem in your neck, that would irritate a nerve that goes down to your arm. And whether it's C5-6 or C6-7, that would remain to be seen and verified by injection, but that would be a much, much, much more likely culprit on a scale of 100 to 1. Thoracic problems are very unlikely, very unusual to cause symptoms. So I would be happy to see you if you want to bring your MRI. We can take a peek at it together and we can ascertain exactly what the diagnosis is. I really would like to stress that to the audience. You gotta have a certain diagnosis. It can't just be based on an appearance on the MRI.
Thank you so much, Sharon, for calling in. I want to go back to something you said about the injections. Is that a common conservative treatment?
It is. Now, I use injections as a diagnostic tool, right? Because if you have pain coming from your neck,
As you told her.
right, if we inject the medication anywhere in your body, it will make no difference. But if we inject the medication right where it hurts, you will feel better immediately.
Right.
That confirmation is essential before surgery to make sure that you never have a situation where you go in for surgery, come out, and have the same pain. That is an absolute never event.
Right.
So in order to confirm that, yeah, I use injections as a diagnostic tool. But that being said, most patients, as in like 90%, get better with these injections and are able to avoid surgery. So thanks to guys like Dr. Mena, most patients are able to avoid an operation.
So what exactly is injected?
Usually it's a combination of a local anesthetic and a steroid. The local anesthetic is what gives me the immediate certainty,
Right.
as it gives the patients an immediate awareness that their pain is better. And then the steroid kicks in at about a day or two, and then if the patient's problem is predominantly inflammatory, then the steroid is curative. So these injections are not a cover-up. They
Right.
really cure patients in many cases.